Welcome back. As cases of COVID-19 continue to climb daily in many Northland communities, as we've reported, local hospitals are feeling the strain of this ongoing pandemic as beds fill up and shortages of staff continue to cause headaches for many. This morning, we are connecting live with Dr. Melissa Simonson. She is the section chair of hospitalist services at Essentia Health. Good morning, Dr. Simonson.
Good morning.
So how are things going there at Essentia Health? We know that you've had a shortage of staff there you've been dealing with, and just how are things going overall right now?
Well, our capacity is stretched currently with both COVID cases and our normal patient population that we would serve. Over the last 2 weeks, we have seen a slight improvement in the number of COVID patients, and that's been stable throughout that period of time. We have about 20 to 25% of our regular medical patients are positive for COVID, and about 30 to 35% of our ICU patients are COVID positive.
Definitely.
Despite this stability that we've seen over the last couple of weeks, we still are within that window of that Thanksgiving surge that we're anticipating.
So moving toward the Christmas holiday, what would some of your recommendations be?
Well, I would recommend staying within your circle that hopefully is within your home unit as well as those very close to you, but trying to avoid anybody that's not within that very close social unit. So we're recommending that people stay home and try to practice those holidays probably differently than normal, possibly virtually or on the phone. But we are very worried about that surge that will be after the holidays. So if you do need to get together with others, please mask, please socially distance, and try to avoid those indoor activities as much as possible, which is of course very difficult in northern Minnesota in the winter.
We've been dealing with this pandemic for about 10 months now. What would you say to those folks who still don't think it's a big deal?
I think we're still in a crisis. It is starting to improve, at least at what we've seen here in the Northland, but across the country it's still surging and we still expect it to surge. We're expecting small bumps in numbers and small valleys every once in a while, but it is going to be ongoing, particularly until we have that vaccine.
Definitely, and there is light at the end of the tunnel, some may think, with the vaccine coming now. What's your take on the vaccine and the latest developments?
Well, I'm very excited about the vaccine. Personally, I will be getting it as soon as it's available to me. The safety evidence and the efficacy have been phenomenal in this process.
Are there folks that need to be worried about allergic reactions? We've heard quite a bit about that the last few days.
Yes, so it's very safe. We've been following a very large cohort of patients. Upwards of 40,000 people have been involved in these studies, which is actually larger than some of the vaccine studies that we've seen over the last few decades. So we know this vaccine is safe. The main side effects that you're hearing about are things that you see with any vaccine. So fevers, headaches, muscle aches, and most of those resolve within a couple of days. Of course, you've seen the couple of severe allergic reactions in the UK, and so that's something that the FDA here will be considering very strongly as far as their recommendations. But as far as we're aware right now, it is a safe vaccine, and I would strongly encourage members of the community to get the vaccine, not only to protect themselves, but to protect other community members, particularly those that are the most vulnerable to getting COVID.
Dr. Simonson, thank you for your insight this morning. We appreciate it.
Thank you very much.
Yes.